bulletins. Ministers have ordered a crackdown on overprescribing of medicines after a review found that 1 in 10 drugs given out by GPs and pharmacists are pointless and potentially harmful. Family doctors will be told to boost the use of social prescribing, such as gardening, walking or volunteering. Well, joining me now in the studio is friend of the show and consultant cardiologist Dr Aseem Malhotra. Aseem, I know that this is something you have spoken about extensively, the fact that we are massively over-medicated in the West, when actually there are plenty of things we can do to boost our health without depending on drugs.
Yeah, absolutely, Alex. I think let's not underestimate this problem. I mean, the over-medicated population in this country and even globally is a major, major public health crisis. So talking about this government report, they said 1 in 10 medications potentially harmful or overprescribed. The same report also suggested about 1 in 5 hospital admissions in the over 65s is because of side effects of drugs. But if you look at it in a global perspective, quite a reliable estimate suggests that the third most common cause of death now after heart disease and cancer is side effects of medications that your doctor prescribes for you. So we've got to understand, first of all, how have we got to this point, and then what are we going to do about it? So we need to move a bit more upstream. So this government report was kind of suggesting this is the responsibility of doctors, and of course we all have a role, but ultimately the reason we're in this situation that we're in is because the information that doctors are using to make clinical decisions when it comes to prescribing is being biased and corrupted by commercial influence. So, you know, I talk about the fact that we've got an epidemic of misinformed doctors and misinformed and unwittingly harm patients. And the main reasons for that is because of biased funding of research, biased funding and reporting in medical journals, biased reporting in the media, and commercial conflicts of interest. So actually, it's the drug industry that designed these trials. Now, one very interesting analysis from somebody in Stanford, in fact, I would describe him as like the Stephen Hawking-like figure of medicine, Professor John Ioannidis in Stanford University, Professor of Medicine and Statistics. And his own analysis a few years ago suggested only 7% of all medical published research is either high quality or relevant to patients. I mean, that's quite an extraordinary figure. So, you know, he's also written suggesting that most published research findings are false. So if you accept and understand that to start with, you can explain what's going on downstream, and that's causing huge harm to public health and to patients. So we need to take a step back. The government, unfortunately, didn't highlight the biggest culprits behind this problem. The elephant in the room is the pharmaceutical industry, who, because they are there just as profit-making businesses, unfortunately, I would argue that their business model is essentially fraud.
What would you say are the main culprits here, then? Because there are, without doubt, medicines that people really rely upon and need and are correctly prescribed. What sort of medications are the ones that you think, in not all patients, but some patients, are being given unnecessarily?
Well, I think it's a little bit more complicated than that, Alex. You're right. I think what's happened is we produce drugs that are beneficial to a minority of people to a certain extent. And the drug industry, then, what they do over time is they try and expand the use of their drugs to many more people, and that's when the excess comes in. If I was to give you a very basic example, you know, to try and help people understand how this works. If you look at insulin, okay, insulin is used for type 1 diabetics predominantly, and it is life-saving for people with type 1 diabetes who cannot produce their own insulin to deal with high glucose because the pancreas stops working properly. Now, it's life-saving for them. Without insulin, they would die. If you gave the same dose of insulin to somebody who was not diabetic, it would kill them. So it's about the right treatment for the right patient at the right time. But also, when you talk about other drugs, Alex, so the big killers in the Western world, cardiovascular disease, you know, cancer, etc. But if you look at the risk factors behind heart disease, you look at type 2 diabetes, high blood pressure, very high cholesterol levels, most of the people taking most of those drugs are not going to get any benefit in either preventing...
That's statins, things like
well, statins, for example, yes,
yeah,
are not going to get any benefit in preventing a heart attack, stroke or death. And the other issue here that needs to be highlighted is there isn't true informed consent going on. So say you came to me and you said, listen, doc, I've got a family history of heart disease, for example. Should I take a statin? My cholesterol's okay, but I've heard it might be life-saving for me. I would say, Alex, listen, you haven't had a heart attack. You're probably low risk. In fact, I'll calculate that you're low risk. The chances of a statin benefiting you are probably 1 in 100 in preventing a heart attack or stroke over 5 years and will not prolong your life. Now, you may take those stats and say, oh, that doesn't sound very effective. OK, I don't think I'm going to take a statin. That conversation doesn't go on. I mean, one of the reasons why we haven't combated this problem as well, with the understanding that most research findings are also not very reliable, is most doctors are unaware of this problem, Alex. Don't presume what I'm telling you every doctor knows about. Most doctors who are listening to this will not even know about this problem. So there needs to be greater awareness. And then when the information through the research is disseminated down to the clinicians, to healthcare professionals, they need to understand it in a way that they can then translate that information to patients. And again, that doesn't happen. So really, I mean, I wrote an article in The Guardian about this a few years ago, and they titled it "Finance Trumps Healthcare at Every Level." And the situation is so bad, that I have called, and I've been supported by other doctors, for a Chilcot-style inquiry into overprescription of drugs and into trying to sort out and protect the public from the excesses and manipulations of the drug industry.
It's fascinating stuff. We could talk about it all afternoon, I'm sure, but we've got news headlines and things to also go to. Aseem, lovely having you back in again. I'm sure we'll be speaking to you again next week. Well, you're watching